It's not just testing folks are looking for, but treatment. And here in Texas, the state says it is running out of the only known antibody treatment to be effective against Omicron. Our Marcelina Benito is also in the medical center tonight with more on this supply issue. Marcelina?
Well, Len, 5 state-run infusion centers have already completely run out of this drug. Fortunately, though, here in the Texas Medical Center, major hospital systems tell me they still have some in supply, but it's unclear how long that is going to last. At this regional infusion center in the Woodlands, run by the Department of State Health Services, folks are driving up looking for COVID-19 treatment, only to be turned away.
Because this Omicron wave is so large, there's a very large demand.
Dr. S. Wesley Long with Houston Methodist says there was no shortage of monoclonal antibodies during Delta surges. Omicron is a different animal.
Those monoclonal antibodies don't work against Omicron. They just don't. They're not effective.
The only one that works now is called sotrovimab.
There was a rationing scheme of sotrovimab in terms of its distribution to the states.
Doctors warning people not to count on it being readily available.
The problem is it is very new. The supply is extremely limited.
At this state-run infusion center, they're completely out and won't have more until sometime in January. For now, Memorial Hermann and Houston Methodist still in supply and still administering it to a select group of patients.
It is really reserved for people at risk of severe disease in an effort to keep them out of the hospital.
Experts stress that now more than ever, the fastest and easiest way to protect yourself is getting vaccinated and boosted as soon as possible.
Monoclonal antibodies are not a replacement for vaccination. If you're at high risk, really need to be careful right now because, again, there's just not, this is one option for treatment of high-risk patients, but it's very, very limited right now.
Now, we did reach out to the White House this afternoon to get some type of clarification and update on when we could see more shipments of this drug arrive here in the state of Texas. We did not get those answers tonight, but we hope to learn more during tomorrow's COVID-19 White House briefing. Back to you.
Hopefully we can get more supplies. Marcelina Benito in the Texas Medical Center tonight. Thank you.